heading into 2021, it looks like that at least that Democrats or just common sense politicians are going to have enough of a majority to be able to get something real done on healthcare. If or when you are elected to the 4th District, what are you going to strive to have in that healthcare bill to help communities in your district?
Sure. Well, first of all, I'll say when I win the district.
Yeah.
Yeah, exactly. Got to always keep the positivity up. No, when I win, well, first, I'm going to take a step back. First, talking about kind of our district in Kansas, part of what needs to happen at the state level is that our local state senators need to get their act together and actually pass Medicaid expansion. You mentioned the case, in terms of Sumner County losing their hospital. That probably could have been avoided had the state legislature taken care of that issue multiple years ago, but certainly within the last 2 years. So that's one point I'd like to make at the state level. But at the federal level too, I think there's a few things that we can do to really help our rural hospitals thrive and our rural communities thrive. One is expanding Medicaid again. I think that's going to be a huge piece of the puzzle, that we need to make sure that there's more funding coming in to our states to be able to help with rural health. That's the first one. Another issue, of course, is staffing. How do you attract enough doctors and nurses and other support in hospitals to come to your community? And I think one of the ways that the federal government could help is maybe creating more incentive plans. So if you're a doctor coming out of med school, rather, some of or maybe all of your student loans might be forgiven if you agree to spend X amount of years in a rural health facility. I don't know if that's 5 years or 10 years or how, that's all negotiable, but something along those lines that would incentivize more people to go to rural communities to really help. And then lastly, on this point, I think what's happening with our rural hospitals is a real signal of what's happening in rural America in a bigger picture. That part of the reason a lot of these hospitals are having to close down is simply that the towns themselves are withering away. The people, the brain drain is real. Children go to their high schools and they leave for college or for other opportunities and don't come back. And I think one of the ways that we could help with rural health and just rural communities is connecting them better with commerce. So rural broadband is a huge, and that would go to telehealth too. You need to have the infrastructure there to bring in economic opportunities, and you can do a lot of businesses online, or you could do your work from home anywhere in the world. And if you want to live in a rural community, you could. And then similarly to that, and more old school, but roads, just making sure that the roads are sufficient for commerce to come to and fro, your particular community. If you have all of that, then you're more likely to keep a sustained hospital as well, because there's enough people to sustain it.